And now to continuing coverage this afternoon at 4:30. We are helping you keep your kids healthy. Thanks for staying with us. I'm Angela Ann.
And I'm Stacia Knock-Ann. A lot of parents talking about the CDC change to vaccine guidance. And today we're looking at how this could affect your next pediatrician visit. 10 TV's Catherine Simon joins us live with more from Ohio leaders about what we all need to know when it comes to back to school season. Catherine.
Stacia, Angela, the CDC's new guidelines recommend that all children get vaccinated for 11 illnesses. The Department of Health and Human Services says that's down from 17 beforehand. Now, with these new guidelines, the director of the Ohio Department of Health says what's important to note is that key portions of the childhood vaccination schedule are the same.
All the controversy swirling around this issue has unfortunately obscured a very, very important point around which I believe there's a pretty broad consensus, and namely that the pediatric vaccinations have always been intended and therefore should always occur in the context of an informed parental decision.
Take a look at your screen. This is the CDC's updated recommendations for all children.
It's a list that interestingly aligns pretty well with the long-standing list of vaccines that are required for school here in Ohio.
Dr. Bruce Vanderhoff, director of the Ohio Department of Health, says one main change to the recommendations is for meningococcal ACWY, the meningococcal vaccine for teens, which is now only recommended for high-risk groups, including college students in residential housing.
That really means that any high school student in Ohio who's contemplating going on to college and potentially living at college really needs to get vaccinated.
Dr. Vanderhoff says there are several other vaccines that are now left up to parents to discuss with their children's doctor rather than having a recommended schedule. Another change, the number of HPV vaccines down from 2 to 1.
Pediatricians almost certainly will continue to recommend these vaccines to their patients, and insurance companies are still required to cover them without cost sharing.
Dr. Vanderhoff says the message from the ODH is two things. They believe in the safety and effectiveness of these vaccines and that they support an informed decision between parents and their children's doctors. Reporting in Columbus, Catherine Simon, 10 TV News.